The Oregon Health Plan says no to chemotherapy and yes to assisted suicide. In a letter to a Eugene cancer patient, the state explains it will not cover the cost of her chemo, but it will pay for doctor-assisted suicide.
Her doctor offered hope in this bottle, the new chemotherapy drug Tarceva. That hope shattered with this letter from the Oregon Health Plan, telling her we were unable to approve the cancer treatment. It will pay for comfort care, including physician aid in dying, better known as assisted suicide.
Who do you guys think you are? You know, to say that you'll pay for my dying, but you won't pay to help me possibly live longer.
The state has a financial incentive to offer death instead of life. Chemotherapy drugs like Tarceva cost $4,000 a month. Drugs for assisted suicide cost less than $100. We took her concerns to Dr. Sam Saha, chairman of the commission that sets policy for the Oregon Health Plan. She says, to say to someone, we'll pay for you to die but not pay for you to live, it's cruel.
I don't think anyone's saying that. That's, I think, maybe an unfortunate interpretation of the letter.
Is it cheaper to pay for somebody to die than to help them live?
That is not a question that we think about. We don't think about if we invest thousands and thousands of dollars in one person's days to weeks, we are taking away those dollars from someone.
I'm not ready. I'm not ready to die. I've got things I'd still like to do.
One of the traditional methods of imposing statism or socialism on a people has been by way of medicine.
The issue of healthcare. I am not the first president to take up this cause, but I am determined to be the last.
We'll pole vault in. If that doesn't work, we'll parachute in, but we're going to get healthcare reform passed.
Today's Tea Parties erupted from coast to coast.
There's no reason for government to be dictating Americans' health care.
It's about the ability to take care of my patients in the way that needs to be without bureaucrats interfering in it.
I trust my doctors, not the IPAB panel here in Washington.
We call it AstroTurf. It's not really a grassroots movement.
Obamacare, as we know, is the crown jewel of socialism. It is socialized medicine.
We've got to get it done this year, both in the House and in the Senate. The stars are aligned.
I don't want this president or any president or his bureaucrats or commissions making decisions for my loved ones.
If Obama could mandate health care, then he could mandate that we do anything.
We have to pass the bill so that you can find out what is in it.
This 2,000-page monstrosity, everybody take one page. If you find a member of Congress, ask them to explain it to you.
The way that the construct of this bill works is that it does not rely on people. It doesn't trust the American people. It trusts government.
Now is the time to deliver on health care.
We're doing this one for the American people. The bill is passed.
Our world has changed. Conversations with friends and family reveal an inner turmoil, a mental pacing that lies just beyond view. Lines of unspoken apprehension flicker through our neighbor's face. Even now, an unseen force grinds away, reshaping the nation Americans know and love. But reshaping her into what? This is the question. For perhaps the first time in American history, we the people fear our government. Politicians forced healthcare legislation into law against the wishes of the American people. America was founded on the concepts of the sovereignty of the individual and the limited power of government. How have we reached a point in American history where we, the people, give government the power over medical decision-making? Government compassion sounds so noble, but in the end, whoever pays holds the power to choose. I'm Dr. C.L. Gray. I became a physician because I wanted to care for individual patients. In fact, I still practice hospital-based medicine in Western North Carolina. When people come to see me, they're very vulnerable, and they're at one of the most vulnerable places they are in their entire life. So it becomes very, very personal, and that personal relationship means an awful lot. But I've started to see a fundamental transformation of the patient-physician relationship as Washington imposes itself on medical decision-making. And I see a country that is increasingly divided over the future of American healthcare. A progression of thought is sweeping this nation. Beneath the debate on healthcare lie two conflicting worldviews, the battle for control over America. One view supports and protects the individual. The other surrenders power to the state. The conflict between these two worldviews is not new. The struggle for freedom in 21st century America is the continuation of a battle that began over 2,000 years ago. Alexis de Tocqueville once wrote, "History is a gallery of pictures in which there are few originals and many copies." If liberty is to survive, we must understand the past. Our story begins in ancient Greece. We find two historic thinkers, Plato and Hippocrates. Hippocrates, born about 460 BC. In the Hippocratic writings, we find the Hippocratic Oath, the special nature of the patient-physician relationship, the sort of sacred trust that physicians would have for patients. Hippocrates says, "For if love of men is present, love of the art is also present. I will not give a pessary to a woman to cause an abortion, but in purity and in holiness I will guard my life and my art." In the same way, I will not give a poison to anyone though asked to do so, nor will I suggest such a plan. Why would Hippocrates say such a thing? I will not give a poison to anyone though asked to do so. Well, in ancient Greece, they struggled with pain control. So sometimes a patient with unrelenting pain will come to the physician asking for medication to take their own life as the only way to escape their pain. But Hippocrates says, I will not give a poison to anyone though asked to do so. The reason is Hippocrates was a Pythagorean, and at the base of Pythagorean philosophy was the concept that human life was special. It was a gift from the gods. It was supposed to be held and defended. So as a Pythagorean, Hippocrates said, I can't take the life of another human or help them even take their own life, because that would be a violation of this sacred trust. And we see that in his last line, but in purity and in holiness, I will guard my life and my art. So this sort of lays out one pole of ethics in ancient Greece. If we follow Hippocrates' worldview through the course of history, where the individual is given intrinsic dignity from God, we can see this reflected in the founding of the United States. And we see this reflected in the inalienable rights of life, liberty, and the pursuit of happiness. In Plato's Republic, we find a very different role for the physician. In his Republic, he describes what he considers the ideal state. this ideal state should be ruled by the philosopher king. The common person is really a cog in a machine. They become sort of a servant of the state, where human life is valued on whether or not they contribute to the needs of the state, not on what they are worth as an individual being. If you follow Plato's thinking through history, you see that it eventually ends in socialism or collectivism, where the needs of the state outweigh the well-being of the individual citizen. In his Republic, he specifically talks about the role of the physician. He says, "But bodies that disease has penetrated through and through, the physician would not have attempted to cure." He, the physician, did not want to lengthen out good-for-nothing lives or to have weak fathers begetting weaker sons. If a man was not able to live in the ordinary way, he, being the physician, had no reason to cure him. For such a cure would have been no use either to himself or to the state. He seriously suggests that the role of the physician is to look out for the financial welfare of the state. In fact, Plato goes on, he says, "These practices will treat the bodies and minds of your citizens who are naturally well endowed. As for the rest, those with poor physical constitution will be allowed to die, and those with irredeemably rotten minds will be put to death." So we have an outline here in ancient Greece of two poles of thought for medical ethics, sort of like an ethical compass, but instead of a north and a south, we have an H and a P. H for Hippocrates and P for Plato. If you're a patient in ancient Greece and you're getting up in age and your knees hurt and your hips hurt and your back hurts and your neck hurts, which physician are you going to go see? Of course, you're going to go see the Hippocratic physician that'll treat you as an individual with respect and try and help you, as opposed to Plato's ideal physician that would either kill you or let you die. So through simple free market forces, this needle swings over towards H and stays there for about 2,000 years, up until the end of the late 1800s, when we run into a philosopher, Friedrich Nietzsche. Nietzsche said that God is dead, and postmodern thought excludes the concept of a fixed truth. In Twilight of the Idols, he writes about a moral code for physicians. He says, "The invalid is a parasite on society. In a certain state, it is indecent to go on living. To vegetate on in cowardly dependence on physicians and medications after the meaning of life, even the right to life, has been lost, ought to entail the profound contempt of society. Physicians, in their turn, ought to be the communicators of contempt, not prescriptions, but every day a fresh dose of disgust for their patients." Note what he says. Physicians ought to be the communicators of contempt, something very, very different from what we think of the patient-physician relationship here in America. Nietzsche continues. He says, quote, "To create a new responsibility, that of the physician, in which all cases in which the highest interest of life or ascending life, this demands the most ruthless suppression and sequestration of degenerating life. For example, in determining the right to reproduce, the right to be born, in fact, even the right to live." So following the writings of Nietzsche, we see the rise of the Third Reich, and with that, multiple medical atrocities. One example are the Dachau hypothermia experiments, where supposedly they were done to learn how to rewarm downed pilots. They would take a victim or subject, immerse them in vats of ice water, nearly freeze them, then rewarm them using various methods. Sometimes they would put them in vats of hot oil, or put them under scalding lamps and burn their skin. And should the victim survive this, they would be nearly refrozen and put through this torture again. So following World War II, we can see the needle had swung towards P. In 1949, the Geneva Convention, they try and pull this needle back towards H. The Geneva Convention created a document to try and re-anchor the roots of medical ethics back to Hippocrates. But it did not include an oath. It's a swearing before one's God to hold a certain set of ideals for all time. Instead, it was more a list of standards open to revision. Revision is exactly what's happened. The first revision was in 1960, where the wording of the Geneva Convention was changed, so human life was no longer sacred from conception, now it was sacred from the beginning. and we see postmodern thought as we can challenge and change the definition of when the beginning of life is. In 1973, we see the legalization of abortion here in America, and the needle continues to swing. In 1985, bioethics philosopher Peter Singer wrote a book called Should the Baby Live? Listen for patterns in thought. He says, quote, "We think that some infants with severe disabilities should be killed. This recommendation may cause particular offense to readers who were themselves born with disabilities, perhaps even the same disabilities that we're discussing." 1994, Peter Singer releases the book Rethinking Life and Death. He says, quote, "We suggest a period of 28 days after birth that might be allowed before the infant is accepted as having the same right to life as others. This is clearly before the infant could have a sense of its own existence over time and allow a couple to decide that it is better not to continue a life that has begun very badly." Sort of reminds you of lives that are not worth living. 1999, Peter Singer is appointed to the Ira W. DeCamp Chair of Bioethics at Princeton University. The needle continues to swing. There is a study done mid to early 1990s, and they surveyed the oaths administered by 127 different medical schools. Only 3 out of those 127 schools actually used the Hippocratic Oath. The other 124 had changed the oath that was being used. The good physician, or the best physicians, would practice more of a socialized medicine, that the Hippocratic physician was sort of falling out of date. What they're starting to do is change the definition of what it means to practice good medicine. The needle continues to swing. In 1994, we see the establishment of the Oregon Health Plan. 1997, physician-assisted suicide is legalized in Oregon. In 2008, we see the case of Barbara Wagner, where the Oregon Health Plan denied her access to chemotherapy, instead offering physician-assisted suicide. January 31st, 2009, the National Institute of Health Director of Bioethics, Ezekiel Emanuel, wrote a paper for The Lancet, a very prestigious medical journal. In it, he introduces something called the complete lives system. Well, specifically, he's talking about what to do with medical procedures in an age of scarce resources. If we look at the graph of the complete lives system, we see the probability of receiving a medical procedure on the left and the age and years on the bottom. The complete lives system produces a priority curve on which individuals between the ages roughly 15 and 55 get the most substantial chance of a medical procedure in an age of scarce resources. Now listen carefully, and we're looking for patterns in thought. Ezekiel Emanuel says, consideration of the importance of the complete lives system also supports modifying the youngest first principle by prioritizing adolescents and young adults over infants. Adolescents have received substantial education and parental care, investments that will be wasted without a complete life. Infants, by contrast, have not yet received these investments. If we look at the graph at the far left is age 0 or birth. That makes me think of Peter Singer saying infants born with a disability wouldn't necessarily receive medical care. Ezekiel Emanuel says we put a lot of time, money, education into getting children into their late adolescence and early 20s. And it also happens to be when they're producing for society. You're young, you're strong, you're productive. You're not consuming much for medical resources, but you're contributing to society. Those are the folks that are getting treatment, up until about the age 55. After that, the probability of receiving a procedure drops way off, but this is when seniors need health care. Ezekiel Emanuel says, unlike allocation by sex or race, allocation by age is not discrimination. Treating 65-year-olds differently because of stereotypes, now that would be ageist. But treating them differently because they have already had more life years is not. Well, as it turns out, Ezekiel Emanuel is the brother of Rahm Emanuel, the former White House Chief of Staff. And as it turns out, Ezekiel Emanuel was also a White House healthcare policy advisor during the development and implementation of the Patient Protection and Affordable Care Act. Why concern ourselves with history and philosophy? Because history and philosophy form the foundations of a worldview, and each politician carries his or her worldview with them when they shape public policy. In looking at the complete live system, I couldn't graph the thinking of Plato any better. I couldn't chart the thinking of Friedrich Nietzsche any better than this. Recall Nietzsche said that God is dead. And with God out of the picture, postmodern thought excludes the concept of a fixed truth. Without a fixed meaning for truth, truth becomes what's true for you. Truth becomes what's true for me. So really, truth just becomes an opinion. Under this worldview, the rule of law starts to break down. Law becomes the arbitrary whim of those in power. Those sworn to uphold the Constitution will create unconstitutional laws. Those given the authority to judge will not judge impartially, but will change the meaning of the law.
The bill is passed.
After a year of debates, protests, and deal-making, Congress has passed a health care reform bill.
My stomach dropped on that day. I felt very sad for my country.
There were people who came from all over America for that vote. It was such a discouraging and frustrating time.
It was a sad day for America.
I felt very strongly that we had gone over a line that I had never seen in my lifetime.
People were saying, why are you doing this? It's not solving our problems.
It was a pronouncement by the leadership in Congress that we rule, you do what we say.
Ecstatic congressional Democrats treated the president and vice president like conquering heroes.
The public was highly engaged on a major national issue, and Congress defied a highly engaged majority.
Senior citizens belonging to the AARP were voting 14-1 against what we now call Obamacare.
3 out of 4 Americans did not want Obamacare passed into law.
So you saw on the floor of the House this extraordinary contrast between people who were trying to sell a law on hope and false promises, and patriots who were saying, this is not right for America. Maybe this law is okay for some other country. It's not right for America.
This health care bill was so draconian, so extreme. The last of the sheep who had resisted being captured in the fold were now being hunted down and brought in through the individual mandate.
We are done.
This was actually a day where the government had finally triumphed. I saw that this was a fundamental change in the role of government and the people, and frankly, I didn't think that it would stand.
In the morning, people were hopeful. They were optimistic that the Supreme Court would uphold the Constitution.
Mandate is struck down! Mandate is struck down!
Justice Roberts started out by saying that the individual mandate is not constitutional under Congress's power to regulate commerce. So I thought, this is definitely going to be terrific. The court is going to overturn Obamacare in total, and we can now move forward with a new idea for reforming health care.
The individual mandate survives as a tax. Wait!
He took a deep breath and said, however, in a decision of 5-4, the Supreme Court has ruled that the individual mandate is constitutional under Congress's power to tax.
They have incorrectly ruled that this is a tax, and they have allowed it to stand on that basis.
I was on the steps of the Supreme Court as the decision came out, and it was a really confusing decision.
Chief Justice Roberts figured out a way to cobble together a majority of one, which is really what it became to be, because no other 4 justices agreed with him on his full opinion.
Well, I was surprised by Justice Roberts' ruling, because what he did was he fundamentally changed the definition of a tax, where we'd always understood a tax to be something that was levied on a good or a service or income. Tax now is equivalent to a punishment or a penalty that has the smell of postmodern thinking. Because if we go back to our definition of postmodern thought, there's no fixed point of reference. Truth just becomes an opinion.
The Supreme Court, in effect, rewrote the Obamacare legislation. This law will stand essentially as it was passed.
Nancy Pelosi said, "We can find out what's in the bill after it passes." I think that meant something different from what we sometimes think. The consequences of the bill are not in the bill. The bill sets up a centralized, powerful bureaucracy. That's one reason we have to study it to understand the consequences of the bill.
As part of the Affordable Care Act, starting in 2014, each of the 50 states is supposed to set up a state-based exchange, and the federal government has provided funds to help states establish these exchanges. Private insurers will sell health insurance in these exchanges so that people can choose the type of health care plan that they want. They're only there for individuals and small businesses. They're not there for employer-based coverage.
State exchanges supposedly will be centralized repositories of information about prices and services, insurance packages offered.
They call them online purchasing exchanges, which sounds sort of like, just go online and decide what you want and click and sign up.
The problem is that under the Affordable Care Act, there is the essential benefit plan. Any insurer is going to have to provide a plan that covers the mandates that the essential benefit plan of the federal government outlines. So it's going to be very, very difficult, I think, for insurance companies to offer plans that can be provided at a specific price that the government wants. It may well be that a lot of insurance companies will say this is not viable for us, so we're not going to offer plans in the exchanges.
People are not going to have choices, and they're going to be extraordinarily expensive, much more expensive than any health insurance any of us can afford right now. These are going to be mega bureaucracies that are going to want to know everything about us. They're going to know how much money we make, how many people are in our family, where we work, whether we smoke or not, what our health habits are, which health insurance plan we've decided to take. Are we eligible for subsidies, Medicaid, different programs? And remember, this is no longer optional. The federal law says you have to purchase health insurance under penalty of federal law.
It's not market-based, it's pretend market-based. It will drive out smaller independent insurance vendors and dealers, and it will centralize and control healthcare within a state. It's intended to centralize.
ACOs are accountable care organizations where doctors and hospitals are supposed to, under the Affordable Care Act, band together in order to reduce the cost of health care. Right now, 150 ACOs have been started around the country, and they're there for seniors. The goal being that doctors and hospitals would do global treatment of patients, which ultimately should reduce the cost of health care.
Accountable care organizations are an idea that sounds good on paper, but doesn't really work. On paper, it's saying, look, we're going to get people together and get various professionals together to treat patients in the most cost-efficient way. But the problem with the accountable care organizations is, number one, they get very big and the patients don't get the individual treatment that they want. And number two, they're trying to do low-cost, high-volume treatment. And that is not what we're looking for in medical care.
These are basically revisions of the old HMOs that the American people rejected in the 1990s. Seniors are going to be assigned to these ACOs, not choose them, but based upon which doctor they're seeing. If their doctor is enrolled in providing care through an accountable care organization, they're automatically enrolled. And they are not going to know that their doctor has an incentive to provide them with less care.
If a doctor and hospital in treating these patients come in at costs below what the accountable care organization, what the government thinks the cost should be, then they will be rewarded. If the cost of the care is over what the government thinks the cost should be, doctors and hospitals will have to pay back money to the federal government.
Maybe they come in, they've fallen, and he thinks, you know, maybe I really ought to do a CAT scan to see if there's any damage here. But he's going to say, wait a minute, I'm going to get dinged if that happens, and I'm going to get paid less for Medicare if I send her to this test. Maybe it's really not necessary. Maybe we'll just wait until next time. All across the board, you're going to see incentives for doctors to provide less care, maybe against their medical judgment, because they're going to get paid less if their billing and their charges go over a certain threshold.
Low cost, high volume. That high volume is the disturbing aspect to patients. And that is run you in and out as quickly as possible, have you see the lowest level of education in your medical professional, and only if you sort of move up through and jump through the right hoops that you get to the doctors and get to see the specialists.
The American people in the 1990s rejected the HMO, the Health Maintenance Organization idea, because care was rationed, because the HMO provider wanted to get a return. The only way they could do that is by rationing care. And so I think the Accountable Care Organization is going to be a form of rationing to keep costs under control and to deny care, in particular starting out with our senior population.
Section 3403, which establishes the Independent Payment Advisory Board, known as the IPAB. It is the purpose of this section to reduce the per capita rate of growth of Medicare spending, and they gained the authority to cap Medicare spending in 2015.
The Independent Payment Advisory Board, I think, really encapsulates the scariest parts of this law, because you now will have an unelected, unaccountable, appointed board of at most 15 people that are going to be making decisions, life and death decisions, about what Medicare services are going to be available to seniors. And if the president doesn't appoint all 15 members, doesn't appoint anybody, then the Secretary of Health and Human Services, the all-powerful HHS Secretary, has the power herself to make these decisions.
The way that the legislation is written, the way that the regs are written, it literally prevents an active practicing physician from sitting on the panel. There's this whole class of people in Washington, D.C., a lot of doctors who do policy work. And you'd say, well, that sounds like a good thing. At least they have some doctors on board. At least they're bringing in doctors. Oh, no, but these aren't doctors. Many of the people who advise the government agencies, who sit on these panels, are physicians in name only, in the sense that once they left medical school or finished their training, they never went into clinical practice. They've never literally had their hands on a patient since then. They've never looked in the eyes of a mother to tell her that her son has cancer. They've been working as administrators and policy people. And a lot of them have PhDs as well as their MDs. These are the folks I call the mudfuds, the MD PhDs. They have a very different attitude and a different philosophy about things. They're number crunchers, and I expect we'll also have our fair share of lawyers, because after all, it is Washington, D.C.
Normally, an advisory panel gives advice to Congress. That advice, if it's good, hopefully is incorporated into the legislation and it passes through the normal process. Now, this has stood on its head with the IPAB. The IPAB's recommendations become law unless overridden by Congress. Let's say the IPAB's recommendations are particularly disturbing, such as no chemotherapy for patients over 65. Might remind you of Barbara Wagner. Well, you can bet every member of the House and the Senate would vote against this because they would never be reelected if they let it pass. So everyone in the House and the Senate would vote against it, but this recommendation would still become law unless Congress passes cuts of equal or greater value. Now rest assured, Congress isn't going to cut Medicare by a greater amount than the IPAB, so they'll be able to come back to you, to me, to we the people, and say, boy, this was a really bad idea. We did everything we could to stop it. But it still becomes law. What it does, it gives them plausible deniability. They can come to you and say they didn't like what the IPAB did, but then they can still know that those cuts will become law. The reason behind this is those that were proposing this advisory board believed that Congress would never gain control over Medicare spending. So they thought it was best to delegate this power to 15 unelected, unaccountable individuals and let them make the cuts.
The legislation says that they are not to ration. However, rationing is never defined.
The drafters understood that it would be attacked as rationing, so they falsely claim there's no rationing in there. I seem to recall that there's no tax in there either. The type of rationing that they probably can't do under the bill is they can't say nobody over 80 can have a hip replacement. They can't say that. But they can say nobody can pay more than $5,000 for a hip replacement. They can say that.
If they're making decisions on how much is to be paid for various procedures and treatments, it's really de facto rationing.
The national debt now stands at $16 trillion. If interest rates go back to historic norms between 5 and 6%, that means we'll be spending between $500 and $600 billion a year just on interest to serve the debt. To put this in comparison, in 2010 we spent just over $500 billion on Medicare, just over $400 billion on Medicaid. That means we'll be spending more on interest on the debt than for either Medicare or Medicaid. As the government is running out of money, trying to squeeze more and more out of the system, the government leans harder and harder on physicians. Now let's bring this back to the IPAB. It is the explicit intent of the IPAB to reduce Medicare spending on seniors. How do you save $716 billion from Medicare? In addition to that, there's a $300 billion doc fix, according to the SGR. So that's almost $1 trillion cut to Medicare. Remember the complete life system, that probability curve of who would receive medical treatment? Well, it's right there at the end of the curve. All you have to do is limit procedures for people over the age 55.
If the federal government is paying medical costs for us, the government has an interest in shortening our life expectancy. The incentive of the federal government now is to reduce our life expectancy once we're not taxpayers anymore.
You know, it's interesting that they call this the Independent Payment Advisory Board, not the Medicare Payment Advisory Board. And that's because tucked into this 2,700 pages of legislation is a provision that allows them to impact other things that may affect healthcare costs. And you can clearly see that's their vision in changing the name of this board.
One of the problems with IPAB is that it talks about being able to curtail costs in other areas than just health care. What public health folks view as health care or affecting health care is very different than what most of us view. They look at guns as part of the public health issue. They look at food and your eating habits. They look at the car that you drive. All kinds of things that are day-to-day behavior that are part of the public health picture.
The federal government could say, if you don't drive a Chevy Volt, you're polluting the air, you're causing people to have chronic obstructive pulmonary disease, COPD, or asthma. Thus, we're going to tax everybody that's not driving a Chevy Volt. Let's see, firearms are dangerous, and maybe what we ought to do is charge you a tax for every firearm you own in your home. Or if you have ammunition, that's dangerous too. Let's tax that too. I think people can make a strong comparison of the Fed from a monetary policy perspective and IPAB from a healthcare perspective. IPAB can utilize healthcare to control every aspect of our lives, just like the Fed controls the monetary side. It is a situation where, under the auspices of Obamacare, the federal government can control every aspect of our lives.
One way to understand the various provisions of the bill is they are all consistent around a theme of centralizing government. In fact, this bill doesn't change healthcare. It doesn't tell us what procedures to use. It is a governance reform that centralizes government and power in Washington, D.C.
If we look at Section 3007, there's 21 times that it transfers power to the Secretary of Health and Human Services. And this is just 2 pages of the bill. The Secretary shall establish, as established by the Secretary, determined appropriate by the Secretary, established by the Secretary, determined appropriate by the Secretary, established by the Secretary, established by the Secretary, established by the Secretary, established by the Secretary, is established by the Secretary.
We've not even seen the tip of the iceberg yet of the bureaucracy that is going to be created by this law. The law itself was 2,700 pages. We already have 13,000 pages of regulation, and they have barely begun. Most of these 159 new bureaus and boards and commissions and agencies haven't even been staffed yet. Wait till they start writing all the regulations to implement this, and all of them impact doctors. And that's why doctors across the board are saying, I'm out of here. I am not going to practice under the dictates of the federal government and how I take care of my patients.
We are already in line for a doctor shortage because of the baby boomers and more people getting sick, and as we have an aging population. We're already set for a massive physician shortage. And a survey that conducted by the Doctor-Patient Medical Association showed that 83% of doctors say that the current changes in medicine make them think about quitting. What that tells us is that in the course of their day, as they struggle to take care of their patients, 8 out of 10 doctors have the thought, this isn't worth it anymore.
In my hometown, both cardiology groups closed their doors. My old group used to be a group of private physicians. We had to close our doors. We're leaving the age of the independent physician, where the physician is now an employee, and that fundamentally changes the loyalty of that physician, because now they have to either respond to the demands of government or an employer, not necessarily to the needs of the patient.
Brought you a little color. You look marvelous.
I would expect that Dr. Welby would be in prison by now because he didn't always play by the rules, because what he was doing was what he needed to do for his patient. He'd have to expand his exam room because it wouldn't be big enough for all the people who are actually in there now. Because now when you go into the exam room, you have the 15 members of IPAB in with you. You have the Secretary of HHS in there with you. You have the people who belong to the Comparable Effectiveness Research Council. You have the CMS bureaucrats, and you have the insurance medical directors. So when you go into the doctor's office now, there are maybe 30, 40, 50 people in there with you, and there's just not enough room in Dr. Welby's office anymore.
The hidden aspect that isn't too often discussed is the people who drafted that gargantuan bill actually intend to use it to control the costs of their own prior ambitious programs.
Medicare, which came into being in 1965, they thought it would cost about $12 billion by 1990. Medicare in 1990 cost $110 billion. So how can we even expect that the Affordable Care Act will bend the cost curve down?
Medicare will be totally unsustainable by the year 2024. It is no longer financially viable for future seniors.
I think then government's going to say, well, we still can't, keep cost under control, so really the government needs to take over the healthcare system and be the sole provider.
The more and the deeper you look into this law, the more you realize, do these people really want the private health sector to survive? They're already trying to put the health insurance companies out of business, especially the ones that are the most marginal companies that are selling to individuals and small businesses that have a very hard time meeting this first round of rules and regulations and criteria from the federal government. But once they put private insurers out of business, then the government becomes the only fallback plan. That takes us toward a single-payer system.
If you're a male, a Russian male, your ability to live beyond the age of 58 is almost zero because the hair is not available. Russian system is a one-payer system, so-called free care. You have hospitals with outdated equipment. Half of the equipment doesn't work at all. My grandfather died prematurely. My father died when he just turned 60. He was admitted to the hospital room with 11 other guys. You have to bribe doctors so they can find time to give him attention that he needed. They operated where they didn't diagnose him properly and they killed him.
Well, I grew up in Canada under the single-payer Medicare for All systems. I moved to the United States in 1991. One reason I took the opportunity was because I wanted to get away from the Canadian healthcare system and live in a society that valued personal responsibility in individuals. In a country like Canada, where the government is the sole provider of healthcare, it is a Medicare for All system. They don't allow private healthcare under the Canada Health Act.
As a doctor, when I got to England, I walked into a situation that I didn't expect at all. The national health system became a good enough kind of program with very, very low expectations. The power rested with the state. As a result of that, most of the population had very few options when it came to health care. National health system, its form of rationing was by waiting.
Today, in Canada, the average wait from seeing a primary care doctor to getting treatment by a specialist is 19 weeks. That's almost 5 months, and that's the longest in the history of recording of waiting times.
My image of working for the national health system was passive people sitting in big waiting rooms, hoping that their number will be called for the most basic of services. The formula for success in England for healthcare providers was get along, don't rock the boat, don't scare the horses, and you will end up advancing within the system.
In a single-payer system like Canada has, there is no competition because private healthcare is outlawed under the Canada Health Act. Technically, competition is illegal, so people come to the United States and pay out of pocket. And certainly if you look at the medical device industry, the pharmaceutical industry, all of the innovation, all of the research and development is done in this country. It's not done in a country like Canada, which does not allow competition. Dr. Brian Day, for example, who runs an illegal clinic in Canada, in Vancouver, the Canby Clinic, where he has an orthopedic surgery, very, very successful. It is illegal under the law, and he has been sued by the British Columbia government for operating this. But I think government is afraid to shut these private clinics down because they know there will be a huge outcry because the demand is there. In England, under the National Institute for Health and Clinical Excellence, NICE, they determine, what is the quality adjusted value of my life versus what is the cost of a treatment or a drug.
The immorality of NICE is that those decisions should be made by the patients and the patients' families. It really is only a formalization of what had to happen at the level of the doctor-patient relationship, where we would have to decide who was the most worthy, who were the people we could help the most. And so we had to do the best that we could under the situation to make as humane decisions as we possibly could. And that really became just too frustrating. And I kept on thinking about America and what America meant, and that's why I came here.
Dr. Donald Berwick was appointed by President Obama as the director of the Center for Medicare and Medicaid Services. In a 2008 speech, Dr. Berwick expressed his admiration for the British system, saying, "I am a romantic about the National Health Service. I love it." According to Dr. Berwick, NICE is not just a national treasure, it's a global treasure. NICE determines the value of a human life compared to cost. In 2009, this value was set at $44,305. Healthcare costs that surpass this quality-adjusted life year value are not acceptable.
My in-laws have suffered from socialized medicine in England. They're both English citizens. They both worked all their lives. They paid into the government socialized medicine plan, believing that when they got old and became infirm, they'd be taken care of as they were promised. The NHS decided that because they were beyond retirement age, their lives were not worth saving. As soon as it was discovered they were ill, they were medicated with pain meds. She was literally starved to death. What was found was the cancer she had was easily taken care of over here in America if we could have gotten her on a plane and gotten her here in time. But because her doctor told her she needed to accept her death gracefully and just give it up for the sake of younger people and that money could go towards taking care of them, she just gave up and shut down, and she died a few weeks later.
If America adopts a European-style healthcare system, we must expect European-style results. Let's look at the 5-year cancer survival between Europe and America. For breast cancer, 79% of those diagnosed with breast cancer are still alive at 5 years. In America, this is at 90%. For prostate cancer, the 5-year survival is 77% in Europe, 99% in America. For stomach cancer, it's 17% in Britain, 25% in America. Cancer after cancer, we find higher survival rates here in the United States than in Britain or Europe. Government compassion sounds so noble, but in the end, whoever pays holds the power to choose.
After this law passed, I was asked to give a speech in Paris about Americans. Finally, you all have come around to where the rest of the civilized world is and provided universal health care. Why is everybody so upset? Why are people marching in the streets saying, don't do this? They wanted to understand what's really, what's going on here. And I said, let me explain this to you. This law is wrong for America because it's just too much out of sync with our political system, with our culture, with our values, to have the federal government come in and tell us what we have to do. The reason they're marching in the streets is because they realize socialism doesn't work. The government can't do it all. The rest of the world is going in the direction of markets and competition, doctor-patient choice, and we're going exactly in the opposite direction.
We have a tremendous lack of knowledge in this country about the foundational principles that our founding fathers gave us in the Declaration of Independence and the Constitution. They never meant the Constitution to be eroded like it has been today. They understood that if we were going to maintain freedom and liberty here in America, that we had to have a firm foundation upon which to build it. That's the reason that they believe so firmly in the Judeo-Christian principles that were behind the Declaration of Independence. The most powerful political force in America today is embodied in the first 3 words of the U.S. Constitution: we the people.
Do we, the people, still accept the fundamental premise in our Declaration of Independence that we are endowed by our Creator with certain inalienable rights? Do we believe in a higher moral code that restricts politicians? Or do we believe that rights come from government? Each American must ask, am I an H or a P? We must ask, What future do I want for American health care?
Just because the Supreme Court held it to be constitutional, the Affordable Care Act is not a done deal.
Ultimately, this is a battle for power, and that's why it is so crucially important that the American people take back this power.
It's really important that a referendum on the Affordable Care Act is delivered by the people to our representatives.
We don't need to make the best of it, and this can be ended, and we can move on to reforms and change the whole conversation.
It's a responsibility for each of us to look into our future, to become educated, to take control of our lives. And it's a race now, because it's a race for people's minds.
We will repeal this law. We absolutely will repeal this law because our freedom depends on it.
Protect the Constitution. Protect the Constitution.
This movement started because the government is out of control.
This is the largest tax increase in the history of this country.
If they can commandeer part of your paycheck, they can commandeer all of your paycheck. If they do that, freedom's gone in this country.
This is a dangerous precedent, especially for people in my generation. We'll have to live with this law, live with its consequences for years to come, unless we do something about it.
We the people can change all this.
Congress can repeal or overturn anything it wants.
We are going to repeal this unconstitutional bill.
This is the time we need to act.
We will stay engaged.
We the people have to start demanding constitutionally limited government. We the people have to demand liberty.
The American people don't want it. It is up to the American people to step up.
It's time that we preserve the greatest nation of freedom and liberty that was ever given to a people. It's time